Hygiene describes activities involved in maintaining personal cleanliness and grooming. Personal hygiene contributes to physical and psychological well-being. ADLs include bathing or showering, washing your hair, or brushing and flossing your teeth. These things promote comfort, improve your self-image, and decrease infection and disease. Most healthy people, however, can perform their own personal hygiene, although there are people that need assistance because of illness or injury. As a nurse, you are responsible for providing the necessary assistance and promoting as much self-care as possible. Promoting self-care in ADLs increases activity, independence, and self-esteem, especially in the very young and elderly. To promote psychosocial well-being, you must respect and accommodate each person's preferences and differences whenever possible. This reflects your caring and promotes maximum participation and independence for your patient. Most patients have personal preferences. One person may shower in the morning to wake up and feel clean for the day, whereas another bathes in the evening to relax before going to sleep. They have choices of soaps, deodorants, shampoos, and moisturizers, and these things vary from person to person as well. Culture and family values and beliefs about hygiene form the foundation for our beliefs as adults. Generally, people in North America consider daily bathing, use of deodorant, and brushing the teeth necessary to eliminate body odors. Other cultures may consider body odors to be completely normal and acceptable, and may find a weekly bath sufficient. Religious or spiritual beliefs also influence hygiene practices. Orthodox Judaism and many Muslim cultures do not allow for the opposite sex to care for the patient. Whenever possible in this type of situation, you should ask another person of the same sex to be in the room with you. Economic status. Inadequate bathing facilities or lack of money for hygiene supplies can influence, however, often the patient bathes. For example, homeless persons or migrant workers, although they may value cleanliness and grooming, might not have access to running water or soap with which to bathe. People living in poverty must focus on meeting the basic needs for food and shelter before they can spend money on energy like hygiene. Parents and other caregivers perform hygiene for young infants and children. Older children learn practices from habits that they learned when they were young, such as brushing and flossing their teeth. As older children begin to perform their own hygiene independently, they are influenced by the media and societal norms and may pick and choose hygiene practices that they seem to be important. For example, some preteens may avoid water and bathing only under parental duress, but teenagers, who are typically very self-conscious, may begin to shower several times a day. Older adults begin to lose their natural oils in the skin, finding that bathing is only necessary 1 to 2 times a week. Less soaps are used, but the use of moisturizers and lotions increase. Not everyone has the knowledge needed to make appropriate decisions. For example, some people who are careful to brush their teeth daily may not know the importance of flossing. Or some women may not be aware of the importance of cleansing their perineum from front to back after using the toilet. Patient teaching is an important part of your hygiene care because most people will eventually take care of their own personal hygiene. Pain severely limits the person's ability and motivation to perform ADLs. The pain itself, limited mobility caused by the pain, and drowsiness from analgesics used to manage the pain may all contribute to a self-care deficit. Limited mobility, weakness, fatigue, surgery, prescribed bed rest, and pain makes it difficult to perform hygiene activities. For example, a patient may be unable to bend over to wash their own legs or feet, cut their own toenails, or even raise their arms to wash their hair. A patient who is weak or lightheaded may be afraid of falling and be reluctant to move about. Such a person needs help, especially getting to the bathtub or shower. Obstacles such as IV lines, oxygen tubing, NG tubes, indwelling urinary catheters, or casts may also interfere with the patient's ability to perform their own care. Sensory deficits. They really diminish a person's ability to perform hygiene measures safely and independently. Safety is a priority for patients with sensory deficits. Patients with head injuries need very minimal stimulation. Whenever providing care, please do it in short intervals to avoid increasing intracranial pressure. Cognitive impairments, such as those found with patients with dementia, delirium, psychosis, strokes, Alzheimer's disease, or even traumatic brain injuries, may make it impossible for the person to initiate his or her own grooming. They may be unable to determine the need for hygiene, much less know how to accomplish the related tasks. For example, a patient with advanced Alzheimer's disease may actually forget how to care for him or herself and will need step-by-step direction. You may also have difficulty interpreting stimuli in the environment, causing the patient to be fearful and resistant to hygiene measures performed by the nurse. If the patient becomes confused or belligerent, the nurse should let the patient be alone or have time to calm down, then reattempt with a lesser degree of bathing, but instead of a tub bath, maybe just a partial bath. Such cognitive deficits may require new or modified hygiene plans. Emotional disturbances may diminish a person's ability to perform hygiene measures. They can cause altered reality states such as psychosis, delusions, or hallucinations. They may dress inappropriately for the weather or the situation and may have poor hygiene practices. Emotional disturbances may cause the patient to be unable to make decisions about what to do next when bathing, dressing, and so on. And the person may neglect his or her own grooming and hygiene because of profound lack of energy or motivation, especially with depression or schizophrenia. Which factor would be most likely to influence the hygiene practice of the homeless client? And your answer is C, the client's living environment. The homeless client may have no access to facilities in which to perform the routine hygiene measures. Early morning care is completed as soon as the patient awakens. They are typically prepared for breakfast, procedures, or other morning routines. At this time, the patient typically asks to use the restroom. This is a good time to wash the face, brush teeth or dentures, and wash the hands. AM care is completed after breakfast. The patient may want to use the restroom or oral hygiene again. They may want to complete their bathing routine at this time and then sit up in a recliner or chair. This is a good time to make the bed and straighten the room. Remember, when shaving a patient with a straight razor, it is important to ask them if they are using anticoagulants. This is due to the prolonged bleeding time. If a patient is on anticoagulants, it is not a good idea to use a straight razor, but instead find an electric razor to use. PM or afternoon care typically is done to prepare the patient for rest or get ready for visitors. The patient should be toileted again or ask the patient if they need to use the restroom. Reposition the patient in the bed or chair for comfort. HS, or bedtime care, is given before the patient goes to bed. Make sure that the patient is comfortable and ask them if there is any routine that would help them to relax. Make sure that the patient has their call light, water mug, and urinal, and make sure that they do know the difference. The TV remote is usually connected to the call light, but if not, place it in the bedside table as well. Before leaving the patient's room, ensure that the patient does not have any pain, all their items are in reach, and the patient is comfortable and ready for sleep. Instruct the CNA regarding the client's limitations, patient limitations and restrictions, and the amount of assistance necessary. You should also make sure that they are aware of any assistive devices the patient should need, such as a cane, walker, or shower chair. They also need to be aware of the care of the tubes. Any obstacles present, such as drainage tubes, catheters, IV tubing, or bandages, and how to maintain them during bathing and toileting. When having to remove clothing from a patient, do not disconnect the tubing. You should thread the tubing through the clothing. Disconnecting it can potentially cause an area for bacteria to enter the body. Observations to make during hygiene care include looking for skin issues, the presence of any lesions, or any special concerns over bony prominences and under abdominal folds and large breasts. The presence, appearance, and amount of urine or stool, or maybe to collect a stool sample if needed. Explain to the CNA why the observations are important. Telling the nursing assistants to report any observations they find that are out of the ordinary, and sometimes even the more experienced ones may not spot it right away. As a new nurse or new to the patient you're caring for, it is wise to complete hygiene with the CNA so that you can assess the patient's skin, level of consciousness, and other assessment pieces that are easier with aid of another person. Conditions that affect the skin in a patient include pallor, erythema, jaundice, maceration, and different skin diseases. In a light-skinned person, pallor may appear as pale skin without any underlying pink tones. In a dark-skinned person, observe for any ashy gray or yellow in color. Erythema is the redness of the skin. This is related to vasodilation and inflammation. It's very difficult to see in a dark-skinned person, so you may discover it by palpating the skin or looking at areas for increased warmth. Jaundice is a yellow discoloration of the skin. It occurs in patients with impaired liver function, and it's best to be seen in the sclera of the eyes. Maceration is the dampness of the skin. This is usually caused by excessive perspiration and incontinence of urine or bowel. This can cause skin to break down more easily when it's damp, especially in the skin folds. Different skin diseases such as impetigo and systemic diseases such as the measles and chickenpox cause lesions and create discomfort and require special hygiene care. When assessing a dark-skinned patient for cyanosis, the nurse should check the buccal mucosa, palms of the hands, and the tongue. Light-skinned people should always be assessed in the nail beds and around the lips and the nose. An assist bath is a term commonly used to indicate that the nurse helps the patient with areas that may be difficult to reach, such as the back, feet, and legs. If a complete bath would be stressful to the patient, you may sometimes give a partial bath. That is, you will cleanse only the areas that may cause odor or discomfort, such as the axilla and perineum. A complete bath means you will wash the patient's entire body without assistance from the patient. Recent guidelines recommend the use of the prepackaged bathing products. Prepackaged bathing products are a set of commercially prepared and packaged pre-moistened disposable washcloths that are warmed prior to use. Recent guidelines recommend the use of prepackaged bathing products. Studies suggest that they benefit the patient by helping to assure consistency of bathing technique among caregivers, prevents inconsistent applications of emollients and moisturizers, decreases the skin damage due to rough washcloths, and decreases the potential for colonization of the skin and the spread of microorganisms with the use of tap water and basins. A towel bath is a modification of the bed bath in which you place a large towel and a bath blanket in a plastic bag, saturate them with a warmed, commercially prepared mixture of moisturizer, disinfectant, and non-rinse cleaning agent, and then you use them to bathe the patient. Because the solution dries rapidly, there is no need to towel dry the patient. Some agencies prefer towel baths because they take less time than a traditional bed bath, and because patients find them satisfactory. This is a preferred method for patients who have mild to moderate impaired skin integrity or activity intolerance, and for patients with dementia. A basin and water bath is a modification of the bed bath as well. This is where you use a disposable basin and washcloths instead of prepackaged wipes. The water should be warmed to around 105 degrees. Each part of the patient's body is cleansed with a fresh washcloth. Skin should be rinsed to remove cleanser and dried well. This should be followed by application of an emollient or moisturizer. Distilled or sterile water is recommended in order to avoid nosocomial infection with biofilm from the water system. Most ambulatory patients prefer a shower. It is a time saver and refreshing as well as cleansing. In a hospital or long-term care facility, some clients can manage a shower mostly on their own, but in most hospitals, the nurse must obtain a doctor's order for a shower due to the drains, lines, catheters, and dressings that could be ruined in the water. Even so, you will still need to be sure the shower or tub is clean and safe. Most hospitals and long-term care facilities have safety grab bars and handrails in the bathrooms, but these may need to be installed in the home. You may also need to prepare the client's bathing supplies, assist him or her into the shower, and help with areas of his or her body that cannot be reached. Assuring that the shower is cleaned accordingly to the facility's policy is an important measure to decrease patients' exposure to pathogens that may lead to nosocomial infections. No matter what type of bath is given, it is vital that the perineum is clean. This is the area between the anus and the vulva for women and the anus and scrotum in men. This area stays dark and moist. This will harbor bacteria and cause excoriation of the skin. Those patients who are continent can care in this area independently, but we have to be diligent to keep this area clean and dry for the incontinent patient. That being said, also consider cultural and personal values. Some patients may wish to have a nurse or caregiver of the same sex completing this care. Another important factor to mention is that when bathing a patient who is morbidly obese, please ensure that you are washing and drying all the folds and large breasts thoroughly. If these areas are left moist, they will cause maceration and foul odor. The confused client becomes distressed and agitated when the NAP attempts to give the morning bath. The nurse instructs the NAP to, your correct answer is A, the partial bath. The intent of the partial bath is to cleanse only the areas that need the most hygienic care. The nurse would continue to monitor the client's emotional and cognitive status and then alter the type of bath accordingly. When providing oral care, assess the patient's teeth. If their teeth are real and permanent, offer a toothbrush and toothpaste. If they are capable, set them up and allow them to brush them themselves. If the patient has dentures or partials, ask if they would remove them so the proper care can be given. Usually, there is special toothpaste and brushes for false teeth. At night, dentures should be put into a denture cup with water and a cleansing tablet. Patients who are edentulous, this meaning without teeth, can have their mouths cleaned with an oral swab and alcohol-based rinse. Another very important aspect to cover regarding oral care is in regards to critical care patients and the unconscious. Patients who are on ventilators are at very high risk for ventilator-acquired pneumonia, or VAP. Their mouths are breeding grounds for bacteria. Keeping them clean may reduce their risk for VAP. As for the unconscious patient, providing frequent oral care is very important. Make sure to follow the protocol of the facility that you work for or that you have your clinicals for when you're providing oral care. While completing oral care, be sure to assess mouth for caries, gingivitis, oral malignancies, and many other abnormal findings of the mouth. The nurse should notify the physician of any of these abnormal findings. Research has shown that oral care is related to heart health. When providing oral care for the unconscious patient, the nurse should, and the correct answer is A. To facilitate oral hygiene and protect the patient's airway, the nurse should keep the patient on his or her side with the patient's head lower than his or her stomach. This will help to keep the patient from aspirating. As you observe the feet, compare findings for both. Assess cleanliness, odor, and skin integrity. Inspect for redness, drainage, and swelling. Palpate for edema and check for cracks or signs of fungal infection between the toes. The color and temperature of the feet provide data about circulation and oxygenation. For example, cold, dusky, or pale feet may indicate impaired circulation or tissue perfusion secondary to peripheral vascular disease. At this point, you would want to check for capillary refill. While performing foot care for the diabetic patient, it is important to teach them to inspect their feet daily for ulcers, injury, or possible gangrene. Diabetics can have neuropathy, which will cause numbness in the feet. They may not realize that they have sores until they have become a big issue. About care of the nails, please obtain subjective data about the patient's usual nail care practices and any history of nail problems and their treatments. Obtain objective data by inspecting the nails for shape, contour, and cleanliness. Assess for redness or swelling of the skin around the nails and observe whether they are neatly manicured and trimmed appropriately. Hair should be brushed daily to remove tangles, massage the scalp, stimulate circulation, and distribute oil down the hair shaft. Use a stiff, bristled brush, but be sure the bristles are not sharp enough to injure the patient's scalp. Comb with broken or uneven teeth because a brush that is too fine can break and snarl the hair or scrape the scalp. Comb tightly curled hair with a wide-toothed comb or pick. Encourage patients to brush and comb their own hair if they are able to do so. Encouraging family members to assist with hair care will involve them in the patient's care and reduce feelings of helplessness. Do not cut a patient's hair unless the patient consents to do so. In most facilities, they will have a policy against this. If it is allowed, it will be done in the beauty shop. If caring for an African American patient, ask the patient or family what products the person likes to use in their hair. Care for hair with different textures and styling needs to be required special attention. With mustaches and beards, they tend to collect food particles. Wash them daily with the bath or the shower and comb and trim them as necessary. Do not shave a person's mustache or beard without permission to do so. When cleaning the patient's eyes, always wipe from the inside of the eye to the outside and cleaning with a new piece of the washcloth or a different washcloth for each eye. If the patient wears contact lenses, determine the type of lens. Is it hard, soft, long-wearing, or disposable? How often he or she wears them, are they daily or occasionally, and for how long at a time? Some patients wear them during their sleep and some do not. History of or concurrent problems with lens usage, like cleaning or removal, usual practices for cleaning and storage, and history of or current problems with the eyes, like redness, tearing irritation, dryness, or scratchy feelings. An artificial eye is made to look like a natural eye. It can be made of glass or plastic. Some artificial eyes are permanently implanted in the socket, but others may be removed daily for cleaning of the prosthesis and the eye socket. If the patient is not able to perform his or her own care, ask about the patient's usual routines. A hearing aid is a battery-powered device that amplifies sound. In addition to these, some patients wear a hearing aid in the temple pieces of their eyeglasses. People with severe hearing loss may wear a body hearing aid that clips onto the clothing or a harness-type carrier that connects to a cord to the earpiece. Digital hearing aids are rapidly replacing the analog models. Hearing aids are expensive, so handle and store them properly. Regularly cleaning and replacing the batteries. Hearing aids need to be replaced every 5 to 10 years. Ear molds usually need adjustment more often than that. And never place a hearing aid in water. Even humidity can reduce their effectiveness. For guidelines to remove, clean, and replace a hearing aid, see the procedure 25-15 in your Volume 2 of your textbook.